Hey, this is Tom Rollins. Thank you all for being here today. I appreciate your helping us as we look at our past, what we've done, and also plan for the future, for our future child welfare system. Sorry I couldn't be with you today. I and some of my team members needed to go down and look at operations in one of our counties, and so really did make that a priority, but I did not want to leave you hanging. I wanted to at least give you some of the vision of what I think we need to be doing with our annual plan as we go forward. So let's take a very basic issue, which is we are here to help children, and of course this is a child, and we also need to recognize, I think, that historically the best place for a child to be, the natural place for a child to be, is with his or her parents. So as an agency, we do all that we can to keep a child safe in the home and support parents in raising that child to be what child should become, which is a responsible, self-actualized adult who can create a future for himself or herself. But we also recognize that sometimes parents can't do it, and we have issues, and we may need to, for safety or for other reasons, a child may need some help. So I think we need to look at our extended family. So we all know that traditionally, when parents can't make it, a child still has a right to be with his or her family, with the people who know him or her. So we need to do everything we can up front to see if we can support the extended family in caring for a child when a child can't be cared for by his or her parents. And through our Family First Prevention Services Act, and really throughout what we're planning for the coming years, we want to be much more focused on how we can support the extended family and preserve the extended family by providing financial resources, child care, by making sure that that child is connected with family. Of course, we also need to recognize that traditionally as well, there is a layer of support around all families called the intimate community. And we know that, for example, in the olden days, when in a small village, if a family ran into trouble, perhaps there was a famine, the barn burned down, someone got sick and died, that the neighbors would step in to help, build a new barn or care for the child. And so we have the obligation and the opportunity as the state to support that intimate community in supporting the extended family and the parents to keep that child centered in the community where he or she belongs. No child wants to be removed from family, from friends, from his or her own school, unless it's absolutely necessary. So through our State of Hope program, for example, we can, as the state, come in and support the building of and the improvement of and the expansion of services for families that are provided both by local governments but also by nonprofits, churches, faith groups, etc. And then of course we have the state. And the state, of course, as I said, the primary role should be to support these more intimate personal structures to support that child in the community. But when that's not possible, the state, of course, does have an obligation to step in and do what is necessary to protect the child. So we need to make sure that we're doing that in a way that respects these as the front lines of our response, as the first response. And then, of course, if we need to place a child in foster care, for example, we should do so as close to the child's community as possible. We should try to facilitate, when appropriate, the reintegration of that child with his or her community. So the state carries great power, but as I said, with that power carries a great responsibility to make sure that we are the outer layer, the outer protective layer, and not the first response to a child who's in trouble. We need to support these other layers. So how do we do that? Well, of course, as I said, we talk about Family First. We talk about that new law. We talk about the new services that will be provided. So we're going to be building community-based providers, trying to help those who are already there to get more along this line of keeping children out of state custody, working with our congregate care providers to make sure that they're able to provide the proper level of service. And of course, it also involves, I think, making sure that we have the right culture in our agency. So who has the greatest contact, for example, with the community and with the parent and with the child and with the family? It is our frontline workers. They are where the rubber meets the road. They are what I like to call the street bureaucrats who actually interact every day with our families and children and provide those services. So we have to create a culture in this organization where they are valued, where we are appropriately hiring them and hiring enough workers, where we are ensuring that they are regarded as the professionals that they are, where we're training them to do the right work and also giving them discretion to do that work without fear that if something does go wrong, they are suddenly going to take the blame for it. So we're trying to build this just culture where if you're a frontline worker or frontline supervisor, when you're doing the best you can under the circumstances, we need to support you and not simply say, well, something went wrong, we had a bad outcome, so therefore it must be your fault. This is a systemic issue we're facing. So let's look at it, it's systemic change. So in terms of some of the more specifics of our program improvement plan, our Kenny A lawsuit, etc., we are going to be working very closely with the front lines and really kind of doing some restructuring along the lines of making sure that when our quality assurance is developed and also implemented. So really creating a better feedback loop between what is going on at the county level in terms of practice with what our policies and what our review and our sort of review of the analysis of the data is telling us. So data integration comes in there very, very much so too. We have the opportunity in the coming years, I think, to begin to use more data. First, to use data that will help us better understand who our families are in terms of, where was this child born? What are the birth circumstances? To, is this family under supervision of some other agency, such as behavioral health or the Department of Community Supervision, or have they had family violence issues? The more that we can quickly integrate our work with data that is held by other state agencies, the better we can develop plans for our families to help them more quickly achieve what we all hope, which of course is keeping that child in a community setting with a family that loves him or her and that he or she loves more especially. So we're going to be using all of our efforts to really recognize the child's right to be with family, and when that's not possible, to try to be as close to family, as close to community as possible. So today, I hope you'll kind of keep these concepts in mind. The last one I want to leave you with is one that I have discussed lately about how our organization works, and I think it's going to work for this group as well. Too many times, of course, we see an org chart. We see that someone's at the top and someone's at the bottom, and so we tend to think that the person at the top of the organizational chart is more important or has more power or authority. The truth of the matter is, in our organization, we should be functioning more like the lungs. So in the lungs, the biggest part of the lungs perhaps is the trachea, or your mouth, where you breathe in, and of course this literally the person who speaks for the agency, it comes out of here. But in reality, when the lungs breathe in air, you have to have every single part of the lung system working. If the alveoli, the smallest parts of the lungs, are not properly exchanging oxygen for carbon dioxide and getting that oxygen in the bloodstream and getting that carbon dioxide out, then the body dies. On the other hand, the more that we can build our entire lung capacity, the more that the body thrives. So if you think about it this way, if our body is the people of the state of Georgia, and if we are breathing in their expectations, They expect us to deliver to the body the oxygen of services and support and care for Georgia's most vulnerable families. So let's try to think, as we build this system, how we can make sure that it is not simply a top-down, we are telling you what to do, and neither, of course, should it only be a bottom-up. We have to make sure that every part of our system, from the frontline worker to the quality assurance function, to the field management, to our state office expertise, make sure that we are all functioning together as one entity so that we can properly deliver those services. It's this way we're going to create an organization that functions like a living creature and that learns and grows and that helps our body, the state of Georgia, the people of the state of Georgia, thrive. Thank you all for being here today. Look forward to continuing this work with you. Thank you very much for your input and your feedback and your criticism. And let's all be transparent about what we do. Don't hold back. So let's exercise a little bit, build up this lung capacity. We'll have a good day doing it. Thank y'all.